Hello, this is a presentation on our team's systematic review of quantitative measures of health policy implementation, outcomes, and determinants. I'm Peg Allen from the Prevention Research Center Brown School at Washington University in St. Louis. We cast a broad net in this review because we were looking for quantitative measures that came from health fields or public affairs and public policy fields that could be used across different policy topics and settings. That was our key aim. We were also very interested in the pragmatic properties of the measures, that is, how easy or hard it is to use the measure that another researcher has developed. We wanted to describe psychometric properties where available and to inform future health policy implementation research. To accomplish these objectives, we had an amazing study team of implementation science researchers. 3 Brown School doctoral students did the heavy lifting: Megan Pilar, Callie Walsh-Bailey, and Cole Hooley, who is now faculty at Brigham Young University. We used the measures review methods and adopted these methods that Kara Lewis and her team of experts at Kaiser in Seattle have developed and are experts in applying. This team guided each step in our review. In the next year, Kara's team will be publishing several new measures reviews, which we encourage you to be on the lookout for. Jonathan Pirtle and Ross Brownson provided policy research expertise and big picture vision. I encourage you to read Jonathan's mental health policy studies if you haven't already done so. The Foundation for Barnes-Jewish Hospital funded this study for 12 months from March 2019 through February 2020, with support from our university's translational pilot program, which has a slightly different acronym than at some other universities. And we did generously receive additional support from Kara, Ross, and Deborah Hare-Joshu, who is at the Brown School. We designed for dissemination, so instead of waiting until the end of the slides, I want to alert you here to the 2 open access items that you may want to browse to learn more about the measures review. Our newly published paper in Implementation Science has the methods details and an overview of findings. Whereas in the web-based compendium, which is publicly available, users can search for measures by implementation process, health policy topic, or setting. I'll show you that compendium a little bit later on. 3 frameworks guided our review. We especially wanted to identify measures of the 8 IOF implementation outcomes as applied to health policy implementation. That is, the implementation outcomes developed by Enola Proctor and her team. We were also interested in implementation determinants of the internal context and looked to CIFER for those constructs. For external context, we read a number of policy implementation theories and frameworks and settled on the framework by Heather Bullock at McMaster University, which she kindly let us use, even though it's not yet publicly available. But you can email her and request her framework. It's hard to talk about the methods without going into more detail than we really have time for, but a few basics. We did search 6 databases through EBSCO and ProQuest search engines. We were looking for health policy studies in both health-related and more broad policy-type journals. We required at least one search term in each of 4 levels: health, public policy, implementation, and measurement. And we used many, many synonyms for each level. All of that is detailed in the published paper. We included only empiric studies, not books. This was really in the interest of time in our 12-month study, and only empiric peer-reviewed journal articles published from 1995 forward until early April 2019, when Cole downloaded the citations. Again, due to time and staffing limitations, we felt we were unable to include the very important small p policies and restricted our search to governmental policies, legislation, and other governmental orders or mandates. Here's the Prisma figure of our search yields. So after much screening, we ended up with 70 unique measures found in 66 empiric studies. We used Covidence systematic review software for abstract and full text screening. Each abstract was screened by 2 study team members, and 2 study team members independently screened and then consensus coded full texts. The main point I want to make here is that among the exclusion reasons, you see 600 nearly studies excluded because the measures were worded in such a way that they could only really be used if you're studying that same policy in that same setting. However, several co-authors are currently working on policy topic and setting specific papers to share additional measures excluded in the large review. Here's what we found. For the Proctor et al. Policy implementation outcomes, acceptability and fidelity or compliance of the policy implementation to the governmental mandate were the most commonly found measures. Megan Pilar is doing a separate review of mental health policy implementation measures, and she found these were common, and she also found that penetration was a common measure. In the overall review, while we were doing the screening, we saw a lot of policy-specific measures of adoption and penetration, but not so many in the measures that actually met our inclusion criteria. We found many more measures of implementation determinants, especially readiness for implementation and the general organizational culture and climate within implementing organizations such as clinics, schools, and hospitals and other community-based organizations mandated, or health departments mandated, to implement policies that had been passed in legislation or ordered by governmental entities. So what really is striking here is how few external context measures we found, even though these were policy implementation studies. So we either missed such measures because of our inclusion-exclusion criteria, and that's possible because policy researchers tell us that policy implementation is local, and so we would have excluded those very policy specific, context specific measures. So we may have just missed these, or it's also possible that the emphasis may still be on the internal setting, the internal context within implementing organizations, more than having a balance of internal and external constructs and assessment. While we view the internal setting as, of course, very important in policy implementation, as it is in implementation of other types of interventions, we also view the external context as incredibly important in policy implementation. So the political will for implementation, not just for passage of the legislation, is one of the drivers of support for implementation, and whether or not there are funds to enforce a legislated tobacco policy, for example. Also, the visibility of the actors and the relationships of the individuals and organizations who are key to implementation will, of course, very much influence how that implementation goes. The visibility of the mandate itself also influences implementation. For example, in sub-Saharan Africa, HIV government mandates have high visibility, which facilitates their implementation. This slide shows that really each of the key aspects of readiness for implementation was also commonly measured. And Megan had similar findings for the mental health policy implementation studies. To assess the quality of included measures, Megan and Callie consensus coded quality scores using the paper's rating scales developed by the Kaiser teams, by Carol Lewis and teams. PAPER stands for Pragmatic and Psychometric Evidence Rating Scales. For the 5 pragmatic domains listed on this slide, Carol Lewis and colleagues, including Byron Powell, who's now at the Brown School, consulted with Russ Glasgow and gathered stakeholder input to develop the detailed scoring criteria. We encourage you to see the citations that are listed here and our newly published review paper for detailed information on papers. What did we find? Megan and Callie were able to assign pragmatic quality scores to all 70 measures. This figure shows the median scores across the measures. We found that most of the measures were freely available, either on a public website or by emailing authors, but the authors did not charge money for other researchers to use the measures they had developed and tested. Implementing organizations receive so many survey requests that in today's world, it's really important to have well-developed measures that are shorter and more feasible for staff in schools, clinics, and community-based implementing organizations to complete, and to keep the language simple. The identified measures in this review, we found, did pretty well on brevity and language simplicity, but few reported scoring and interpretation of scoring instructions that would have made the tools easier for others to use. In Megan's review, Megan found similar results in mental health policy implementation and the same median scores. Psychometric properties were not reported for the majority of the measures. When reported, internal consistency was a common type that was reported. I don't want to go into the details here because we found so little. The scores were low because a lot of the authors did not report validity evidence. and some did not even report pilot testing. So I refer you to the details in the newly published paper. As noted earlier, part of our dissemination was to develop a compendium of identified measures that is now publicly available. Again, Megan and Callie did the heavy lifting. They worked tirelessly to fine-tune the compendium content. And we again credit Carol Lewis and teams because we were able to engage the same consultant who had developed a web platform for their review of tools assessing social determinants of health, which I encourage you to Google and to see their paper. By using similar computer programming, the web designer was able to keep the costs down for us so that we could even do it. So let us know if you want the contact information for that web designer to help you disseminate your future research, because we found her just great to work with, and she made it as easy on us as she possibly could. We want to turn now to taking a look at that compendium online. So in this homepage, you see that we have credited our university and also Kaiser because of their strong role in this compendium and in the entire measures study. And we also want to credit the full team who are credited here in the About the Review webpage, which also tells you a smidgelet about the methods, but really the methods details are in the published papers. If we go to the About Measures webpage, we see a listing of all of the included tools. And if we click on the name of a measure, we find the measure information page that these took so much time for Megan and Callie to develop, and wow, they did a great job with this. So when we were able to find an article that described the development of the measure, we provided a link to it. Clicking on the link, you get to the abstract and the ability to download it if it is open access. The measures information pages also show that the constructs that we found and describe in general terms the general topic and setting. We also, for each measures information page, we also show the paper's rating scores that Megan and Callie consensus coded, and we show them separately for the pragmatic 5 domains and for the 9 domains covered in the psychometric scales. The How to Use This Site webpage describes a little bit about the implementation outcomes and determinants, and begins to explain the filtering or sorting system that we used. So when we go to the Find Measures webpage, this is where we can do the interactive searching. The important thing to notice about our filters is that they use an OR function instead of an AND function. We would have really liked the AND function, but cannot afford the complex computer programming for that. So instead it's additive. So it means if you have all these measures of implementation costs, and then you want to see which of the mental and behavioral health studies assessed cost. You can't see it that way. What you get is both the measures that assessed cost and the mental or behavioral health topic studies. So if we look at just the mental or behavioral health studies, we find 9 measures that we show in the compendium. And to look at a couple examples, if we look at the work of Charles Glisson, who I would imagine many of you are familiar with, and I too have used his work in my studies of health departments. We find his measures development article, information, a little bit of information about the measure, and the pragmatic and psychometric criteria scores. If we take a look at Greg Aaron's work, which again, since my understanding is that you are in mental health fields, so you would likely be familiar with Greg Aaron's work, and in public health, we have also used his framework and measures in our work as well. And again, we see the scores that we came up with. A tool you may not be familiar with is this, that was certainly new to me, is a measure that comes from researchers working in the Netherlands. And again, there's a measures development article that you can link to and then download, as well as being able to download the use studies. So we did not, again, have time in the 12-month study to do all the forward citations we would have liked to in order to find every single use study. So for use of developed included measures, we show only those that popped into the original search. So that's a little bit about the measures compendium, and I encourage you to browse it on your own, and please use whatever will be useful to you in your research, and do let us know of questions as you dig in. So that's a bit about the compendium. Limitations of this review, some I've mentioned. One I did not yet talk about is that there's several reasons why we could have missed studies that we would have included. And one of those reasons is that unlike PubMed, where the search terms are applied to the full text, in EBSCO and ProQuest do not do that. In EBSCO and ProQuest, the search terms are applied only to words in the title, abstract, and subject headings. And researchers used all kinds of terms, and so the terms for their constructs wouldn't necessarily have even shown in the subject headings or abstracts. So we no doubt missed studies. The other limitations I've pretty well mentioned. We do have some lessons learned and recommendations for future health policy implementation research. We very much hope that there will be dissemination of measures that have already been developed and tested and shown to be reliable and valid and have good pragmatic qualities as well. We really hope that the measure's contributions from the many fields that contribute to implementation science and to traditional policy research come together to inform each other's work, because policy researchers can help those of us in implementation science expand how we study external contexts that are so key in policy implementation. And implementation science researchers offer rigor in quantitative methods that, frankly, we found lacking in some of the studies from other fields. So NIH and D&I units at NIH are increasingly exploring ways to prioritize and integrate policy implementation research within implementation science. We look forward to advances in measuring health policy implementation so that we can better inform how best to implement effective policies to improve population health. With that, I thank you, and we look forward to seeing you on Zoom during IRI to address questions about this review. And you can email me questions ahead of time if you wish. Also, if you have a measure you think should have been included in the web-based compendium, please let us know. We're very interested. This last slide shows key references, and this concludes the presentation. We wish you all the best in your research, and several co-authors and I will see you on Zoom during IRI. Goodbye.